Hello everyone, I'm Jim Longworth and welcome to another edition of Forsyth County Connections, coming to you from the studios of Cable 2 through the courtesy of the good folks of the Winston-Salem Forsyth County School System. We appreciate their hospitality. We have a lot in store for you today, a lot of great guests, important information coming your way, and a wide range of topics. We'll talk about everything from emergency situations down to pickleball games and everything in between. But where we want to start is talking about something that everybody can identify with, and that's the flu and flu season. And our special guest is Kamilah Pleasant. She's Assistant Health Director and Director of Nursing for Personal Health and Clinical Services with the Forsyth County Department of Public Health. That's a big title. How you doing?
I'm doing pretty good.
Okay, the dreaded flu. Let's talk about it. What's the outlook for this year's flu season, and how's it been so far?
Right now, at this point in the flu season, it's hard to tell what the outlook is going to be. But so far, we've had minimal cases, which is a good thing.
I noticed during the pandemic when a lot of people were being mandated to wear masks and everything, the incidence of flu went down, which I guess kind of makes sense. All right, now they're saying, well, we might have more COVID and all this. I don't know about masks. But what do you think is the best defense against contracting the basic flu?
Getting your flu vaccine. That's best defense. Of course, hand washing and things like that, but getting your flu vaccine.
Now, is there more than, and I don't know about this, you tell me, is there more than one kind of flu vaccine, and who can receive them?
There are a few different types of flu vaccines. So anyone 6 months of age and older are eligible to get the flu vaccine. There are different types depending on, of course, your age and egg allergies as well. So you have your basic Fluzone quadrivalent, and that's anybody 6 months of age and older.
Right.
We have Flu Block that's recommended for anyone with the egg allergy, and then ages 50 and older.
So the folks that have said, I'm staying away from the flu vaccine because I have an egg allergy, that they don't have to stay away from it. There's one that's just for them. They just need to tell the doctor or the pharmacy which one. And
then you have your high dose, which is the extra coverage for ages 65 and older.
So for folks like me, I should get, do I have to ask for, well, yeah, do I have to ask for a higher dose? Or if I go into a pharmacy or something, are they going to know or what?
Yeah, you give them your age, and they'll say, based on your age, we recommend you get this dose. But you can specifically go and ask, I want the high dose flu vaccine. Where can we go to get a flu vaccine, and is it free if we go certain places? So your doctor's offices, your primary care providers, most health departments offer it, and then most pharmacies will also offer the flu vaccine. The flu vaccine is free of charge, zero copay for majority of health insurances. And then of course, in Forsyth County, the health department, we have the flu clinic that we operate each year, and we do that at no charge to the community.
When does that usually come about, the clinic?
We started in the month of October, so this year we're starting it on October the 2nd, and that's free of charge.
So it's hard for you to have a crystal ball and say, Jim, it's going to be real bad or not. You just don't know yet.
We don't know yet.
I guess before time runs out, let me ask you something. We didn't plan this or anything, but you and I have just met. What's gratifying to you about your job? Because I know you take it very seriously, and I'm just wondering, what do you get out of it?
Being able to help people, doing the outreach, and then being able to help the staff that I serve.
That's a good one too, from what I hear, and y'all are doing a great job.
Thank you.
Kamilah, thanks for stopping by.
Thanks for having me.
All right. We'll be right back after this.
Help emergency responders help you when you can't help yourself. Forsyth Cares. Forsyth Cares, the Community Assistance Registry for Emergency Services, allows you to register yourself or someone in your household sharing health conditions or information that might aid in your care should your home be the subject of a 911 call.
911, what's your emergency?
Operators will seek critical information, medications, conditions, or in the case of a wandering child or an adult with cognitive disabilities, places they like to go, or even if they have access to a vehicle. The information is stored in a database only accessible to first responders and 911 agents. Get more information at forsyth.cc/Forsyth Cares. In the moment that your life depends on a fast response, get information to first responders that can aid in your or your loved one's care. That's forsyth.cc/Forsyth Cares.
Back now on this edition of Forsyth County Connections. Thanks for staying with us as we come to you from the studios of Cable 2. Our special guest right now is Bryan Gallimore. He's Assistant Chief of Operations for Forsyth County Emergency Services, and we welcome you to the program.
Thanks for having us, Jim.
First of all, I want to ask you something I don't think we've covered on this show before. What's the difference between somebody who suffers a heart attack compared to somebody that is in cardiac arrest? Can you clear that up for me?
Absolutely, that's a great question, and we get that question from a lot of folks. Someone suffering a heart attack, they have a clot somewhere in the bloodstream that supplies the heart with oxygen-rich blood, and that clot, it causes the muscles to be deprived of oxygen, which further causes pain, shortness of breath.
Right.
And so in comparison, that technically we call that a myocardial infarction, but technically in comparison, when we discuss cardiac arrest, that's actually when the heart stops beating, and it's an electrical dysrhythmia, and that person is clinically dead at that point.
Well, now, how do you define a cardiac arrest survivor? You sent me an email one day, and I think maybe it was you or Joey sent me one. A cardiac arrest survivor, how do you define that?
So, obviously someone has went into cardiac arrest, and through good CPR and early defibrillation, typically we can restore that heartbeat back and that EKG, the electrical rhythm of the heart back, and get the patient breathing again, and stabilize the patient because they're really critically ill at that point in time, and get them transported to the hospital for definitive care. So we define a survivor as someone who has survived not only that cardiac arrest, but because of the care they received, right? First by bystanders, and then by EMS and first responders, and then also the hospital.
Right.
That they've returned to a good quality of life, similar to what they had before they went into cardiac arrest. So that's how we define a survivor.
All right, so say somebody, they survived this, and you kind of, as I say, brought them back to life. How would you compare the rate of survival in that in Forsyth County to, say, state figures, national figures? I mean, do you know how we're doing?
We're doing very well. We're very comparable with national and state figures. Right around now, 2022, we're at a 30% survival rate, and that number increases to 33 with bystander CPR being performed.
Now, you mentioned CPR and bystanders, so let's circle back to that.
Sure.
What contributes to, and I think I know what you're going to say, what contributes to survival and better patient outcomes? Having more people involved quickly, or what?
So, better patient outcomes in cardiac arrest survival depends on, first of all, the quicker we're notified, and the system as a whole, from first responders, EMS, and the hospital are notified of this incident, and we can be involved, the better off. But CPR, right? That's going to help oxygen be pumped to the brain and the other vital organs to keep not only that person may be clinically dead at that point, but we're hoping to salvage as much as their quality of life as we can.
Right.
Early defibrillation, either through an AED or through a first responder with an AED or a paramedic with a defibrillator, right? Restoring that heartbeat, getting that back, that's going to have a huge impact on that person as well.
And so I'm guessing that it's really important for you guys to have a good line of communication with the hospitals, and how does that benefit everybody?
Absolutely. We're in touch with the hospital via radio, also in touch with the hospitals via cell phone. And so having that ability to give early notification of a critically ill sick patient, where they're at in their assessment, and then also what treatment we perform for them and how they're doing, kind of dictates what's going to happen at the hospital. So we know that time is muscle, and our big goal is to provide all the treatment we can, the same treatment that the emergency room probably would deliver to that patient as well, and hopefully bypass the emergency room and go straight to the cardiac cath lab where definitive care is done, right? Time is muscle. We want to get them to exactly where they need to be.
Well, I tell you what, Bryan, I just appreciate all the work you guys are doing, your team and everybody, not just in these situations, but in all kinds of life-saving situations, and we appreciate your hard work. Thanks a lot.
Thank you, sir. I appreciate it.
All right. We'll be right back after this.
This is what too much sounds like. This is what stress feels like. And this is what help feels like. If you've lost a job, worry about your next meal, or have trouble making it through the day, we can help. Text STRESS to 211-211 to find a solution.
Here you go.
Thank you.
Thank you.
Back now on this edition of Forsyth County Connections. Thanks for staying with us. Our guest right now is Andrea. We call her Annie Vasquez. She's a substance use health educator for Forsyth County Behavioral Health Services. And welcome to the show.
Thank you for having me.
I want to talk about some serious things in just a moment. But before I do that, I'm always curious, who calls you Annie? Who calls you Andrea?
Usually if I'm in trouble or it's a very legal situation, then they'll call me Andrea, but most people call me Annie.
All right, so if you're in trouble or if it's a legal thing. Okay, thanks, Andrea. No, I'm just kidding. All right, now let's talk seriously about drug overdoses and how prevalent is it in Forsyth County and who's most impacted by it?
It has a huge presence in Forsyth County, unfortunately, and it affects nearly everyone. So I pulled some data recently for another meeting, and we had 190 calls in about 6 weeks for overdoses. That includes all overdoses, but that is only overdoses that EMS respond to.
190 calls.
Yes, in about 6 weeks' time. And like I said, that's only EMS calls. So people who are using naloxone on their own or do not call 911 are not included in that number. But it affects everyone. Our youngest person this time, I think, was 14, and the oldest was 90. But we have seen calls as young as 2 years old. 90?
Yes. Well, I'm being ignorant, I guess, but that would had to have been involved with mixing drugs or taking the wrong kind of drug. Are you talking about
it can be illicit drug use or it can be prescription drugs. We've seen both. But sometimes in the older population, it is, hey, I forgot I already took this medication.
And they double up.
Yep, and they take it again.
What about, let's backtrack to the youth market for a second. What can parents do, or can they do anything to keep their kids from using in the first place?
Yeah, so number one, the really important part of that is communication. Have a conversation, and not just one conversation, multiple conversations, especially if your kid asks about it. If your kid asks you about a specific drug, that means they've already heard about it. Mm-hmm. They're already talking to their friends about it. Be open, honest, and upfront. Be as basic as you can be with them, but also be sure to say, I don't know, if you don't know the answer.
Well, I guess what I'm gleaning from you too is, shouldn't parents get on the ball and get ahead of this thing?
Absolutely. So one of the most important things with kids, especially the youth, is locking your meds. Really important, because kids can get into your medicine cabinet, even if they don't know what that drug is, making sure we have med locks available. It's also keeping alcohol out of the risk,
That's right.
Yeah,
That's right.
because the number one place that kids get alcohol is from their parents' home.
If somebody's in a crisis situation, where do they typically, can they receive help right away?
So we have several places you can go. One of the biggest ones is called Behavioral Health Urgent Care. It's located on Highland Avenue. It's open 24/7, just like you would go to an urgent care if you break your arm or your leg. You can go there if you're having any sort of mental health crisis or substance use disorder crisis, and they're going to be able to help you and treat you 24 hours a day, 7 days a week. But you can also call 911. So what you get when you call 911 is you can get two different teams, either the BEAR team, if you live within the city limits, or you can get what's called MIH, Mobile Integrated Health. Both of those teams are able to go and address mental health or behavioral health services right then. So instead of getting police or fire, you may get a counselor or a therapist that's able to assist you in that moment.
That's great. And that all happens in Forsyth County?
Yes, it all happens.
Very quickly, before we run out of time, what other community resources are available for folks that have a substance use disorder?
Yeah, so we offer Daymark, which is also in that Highland Avenue Center. Daymark does assessments every day, and it's in a walk-in basis, so people are able to access assessments, and if they need medication, they can get referrals right then and there. We also have the pharmacy, so we have a public health pharmacy on Highland Avenue as well that does lots with our behavioral health meds. So there are lots of good resources out there.
Is there a website or something people can check out once in a
Yeah,
while?
so we have a website that's connected to the Health and Human Services website for Forsyth County. Just look under FROST, which stands for Forsyth Regional Opioid and Substance Use Team.
All right. Annie, I appreciate you taking time to do this. The work you do is so important, and we're so grateful to you, and hope you'll come back sometime.
Yes, I definitely will. Thank you.
All right. We'll be right back after this.
Don't procrastinate. Vaccinate. School immunizations are available right now at Forsyth County Department of Public Health. Make sure your child is prepared for next school year by getting their immunizations now. Immunizations are available at no charge for Medicaid and uninsured patients. Call 336-703-3324 to schedule an appointment. For more information, visit forsyth.cc/public health. Forsyth County Department of Public Health. Promoting health. Improving lives.
Unlike other health concerns, mental illness is not always easy to see.
DEPR.
Mental illness doesn't show up on a scale. Bipolar? Sorting out a mental health concern takes professional diagnosis and treatment.
Anxiety. I thought so.
If you or a loved one has a mental health concern, don't go it alone. For 24-hour free and confidential information and treatment referral, call 1-800-662-HELP. Learn more at samhsa.gov/support.
Back now on Forsyth County Connections, and we want to spend a few minutes talking about HIV, and we're going to do that with an expert in the field. Rithy Vang is Regional HIV Prep Coordinator for the Forsyth County Department of Public Health. First-time visitor to the show, and we appreciate you coming down.
I appreciate y'all having me.
How common is HIV now, basically, and we're not going to get into a lot of statistics, but how common is it, and how is it affecting Forsyth County?
Sure. So, although anyone can contract HIV, it is more common among men who have sex with men, as well as people with multiple sex partners, unprotected sex, and injection drug users. Here in Forsyth County, we have seen an increase in numbers in terms of new diagnoses.
Right. But now, of course, I know you're too young to remember this, but when the virus was first really identified in the 70s, there was and even up, I guess you can answer this up to today, but there was kind of always a stigma that if you had HIV. Now, is there still a stigma surrounding that? And if so, is it viewed any different in the community today?
So there is still stigma around HIV. Some individuals will automatically assume that if someone has HIV, they have AIDS, which is not the case. HIV can develop into AIDS if left untreated.
That's the important thing too, because fortunately there are ways to treat HIV that we didn't have in the beginning.
Exactly, yes. With today's technology and science, there is treatment known as antiretroviral therapy, or ART for short, that will help with reducing the viral load in an individual's blood to the point where they can become undetectable. And you'll hear this a lot when it comes to HIV, U equals U, which basically stands for undetectable equals untransmittable.
How has, over the years, has it changed, or has there been a change in the way we can protect ourselves against HIV?
So not a lot has changed in terms of how to protect yourself. Really, it's use protection, wearing condoms, getting regularly tested so that you know your status.
Now, when you say the word, I didn't mean to interrupt you, but when you say regularly tested, how often should a person be tested?
Sure. So an individual, one, it's recommended an individual between the ages of 13 and 64 who are engaging in risky behaviors such as injection drug usage, multiple sex partners, unprotected sex, that they should be getting tested for HIV at least once a year.
Okay. As we would say about elderly folks, when we talk about COVID and things, when we talk about HIV, you're kind of saying, well, there's an at-risk population, and they're usually younger and more socially active and sexually active folks. Should someone living with HIV be concerned about co-infection with other STIs? Is that an issue?
Yes, so someone, a person who has been diagnosed with HIV should be concerned with co-infection. Although not for certain, it is common for an individual to have co-infections such as gonorrhea, syphilis, hepatitis, etc.
But again, the important thing is to get it treated when you know. So there, before we lose time, then let's talk about the process of contact tracing. How involved in that is that, and in trying to link other folks?
Yes. So a newly diagnosed, or an individual who's newly diagnosed with HIV will get contacted by an agent from the Disease Intervention Specialist, or DIS for short. They will get in contact with a person's recent sexual partner or partners, and getting them referred to treatment in case of an exposure.
I got you. Now, I guess the last thing I want to know is there a particular website that people can go to for more information, or where should you guide them to?
Yes, so POSSE, which is a program with the health department, stands for Preventing Ongoing Spread of STIs Everywhere. We have a website on the Forsyth County Health Department. We also have social media they're able to check us out on. They can always email or give us a phone call as well.
Look, I appreciate the work you're doing and trying to educate people, and thanks so much for doing this.
I appreciate you guys having me and being able to spread awareness.
All right. We'll be right back after this.
Every year, 4.5 million young adults between the ages of 18 and 24 visit the ER.
It's every parent's nightmare.
Umergency gives you all the tools you need to quickly and effectively manage your family's emergency. Umergency provides instant access to vital resources, customized to your student's campus and local community, digital consent form, and built-in urgent alert button. Umergency gives you peace of mind when you need it most. Download your Umergency app now.
We worked our whole lives to save, just to spend it on time. With these two, filling buckets of memories. This is what makes life, life. Yet how much of life are we willing to miss out on? Because even mild hearing loss doubles our risk of dementia. Yes, dementia. Good hearing health is essential to staying engaged and doing what we love. Hear well and stay vital. Get a hearing health check every year.
Back now on this edition of Forsyth County Connections. So glad you stayed with us. This is our final segment of the show. And our special guest is a guy who's been here with us several times before. We are always glad when he can take time to talk with us. Chris Weavil is Director of Forsyth County Parks and Recreation. Welcome back, sir.
Thank you. Glad to be here.
Now, you sent me an email, and at first I thought you were kidding around, and you said, we're going to talk about pickleball. And I had to think about it for a second. And I want to know, what is pickleball? How did it get started, and how is it played? So school me on that.
Well, it's kind of new to me, but pickleball is a racket sport that was born in the mid-'60s on Bainbridge Island in Seattle, Washington.
Wow.
Joel Pritchard and Bill Bell developed or created this sport to solve a problem: bored teenage children. They came up, they improvised the sport with things that they found on hand, that they had on hand: badminton court, ping pong paddles, and a wiffle ball. It's played on a court. It's basically like a badminton court, about the same size. It's 44 feet long, 20 feet wide. It does have a kitchen on either side of the net in the middle. Not one you cook in, but they do have a kitchen, which is a non-volley zone. It can be played by 2 or 4 players. And it's
sort of it sounds like sort of a hybrid sport, isn't it?
It is. Oddly enough, the name pickleball throws a lot of folks. Kind of threw me when I first started hearing about it.
Yeah, why is it called pickleball?
Well, pickleball, since the sport was developed in Seattle, if you're familiar with the geography of Seattle, it's a water-based city. It's on the Puget Sound. The rowing is a big sport, evidently in Seattle.
Right.
Mr. Pritchard's wife was an avid rower, and she came up with kind of the term that's used in rowing. It's called a pickle boat. A pickle boat is a team of rowers that are made up from leftover rowers that didn't have a boat to row, so they were made up of these multiple folks.
Golly.
All put together at random.
Now, how popular is this sport now?
The sport, very popular. In 2023, I think the latest statistics came out, there are 36.5 million players in the United States.
Gosh.
It's grown 158% in the last 3 to 4 years. And it, like I say, it's the fastest growing sport in the
Well, it
United
doesn't,
States.
look, it doesn't, from what you're describing, you don't have to go buy expensive golf clubs when you're playing golf or an expensive tennis racket that some professional uses or whatever. You can just sort of get out there and do it.
You can, and it's kind of played very fast. You can play a match in about 15 minutes.
Right.
So lots of folks get to play. Folks get to rotate around. They play. It's a social occasion as well for folks. So it's very neat to have.
All right. The big question is, do we have any pickleball courts in the county?
We do. We've just recently opened 9 dedicated pickleball courts at our Joni Moser Park location, located in Louisville. Those are dedicated to pickleball only, 9 courts there. We also have 8 other dual pickleball tennis courts that are located at our Union Cross facility in southeastern Forsyth County and our Walkertown facility kind of in the northeastern part of the county.
Well, Chris, if this is such a popular thing and growing like it is, I'm trying to think of the demand for this. Do I need, like if I want to play pickleball, do I need to call the Parks and Recreation Department or get online and reserve a court or what?
For our dual pickleball tennis locations, you don't. They're first come, first serve. They're just kind of walk on play.
Right.
We have 6 courts.
I'll just go out there and tell them I know you.
Yeah, that'll get you nowhere.
Yeah. So you don't have to reserve it. It's just first.
We do have a couple of courts at our Joni Moser location. We have 3 courts that are available for use, but if they're not being rented, they are open for free play.
And again, circling back here on the website thing for more information, where could people go?
They can go to the county website at www.forsyth.cc/parks.
Okay. Do you play pickleball?
No, but I've got a bunch of people that are going to drag me out on the court here in a very short period of time.
Yeah, there's some people over to drag me out there, but for a different person. All right, look, I appreciate this. This is fascinating, and it's just growing every day, isn't it?
Yes, sir.
Thanks, Chris, for doing that. As we wrap up, I want to just mention, since we were talking about websites, once again, you've been seeing this all show long. connectwith.forsythcountync.gov. Lots of good information. You can see episodes on there. Episodes of this show on YouTube everywhere now. We're getting a lot of feedback on that. I want to thank, of course, TJ James, our director, and Kevin Wren, and they keep things going here at Cable 2 at the studios. Jeff Fabrizio, of course, for being our editor and watching over me to make sure I don't make mistakes, and Ed McNeil, our executive producer, along with Dudley Watts, county manager. For everybody here at Forsyth County Connections, I'm Jim Longworth. We'll see you next time.